Sorry for the minutes we've lost. I want to I want to welcome you to this evening session. For those who are joining us for the first time or the first few times, my name is Betty Oloo, a Neolife distributor of many years. And I'm always very happy to have this opportunity to spend this time talking about our products and how to better position ourselves to help those whom we come across. As you might remember, if you are with us last week and the week before, for the remaining period of 2024, we are going to try to keep up with the Q&As that we've had a backlog of, and maybe by the time we knock off for the holidays, we shall have dealt with the majority of the questions. So let me invite you to sit back and relax for the next 1 hour when we'll be talking about the Q&As that are here. I think you'll find them interesting. And as always, we are happy to hear from you. If you have a question you want to ask, a suggestion, maybe a topic you want us to include, it's always a very good idea. I find that our best ideas come from what you share with us. So thank you very much for joining us, for taking the time and for spending your data on our training. And I want to start immediately with a question from someone who wanted to know what to recommend for epilepsy. That is someone who gets seizures or epileptic fits. And as usual, part of the answer is going to be about some lifestyle points that you can put in place, as well as supplements that you can use to augment your lifestyle changes. So the first point I wanted to make are of the lifestyle points. The first being a ketogenic diet. A ketogenic diet is a high-fat, low-carbohydrate diet, which has been found, in fact, to be quite effective for quite a number of epilepsies. And in fact, this was the main method used before they had medication for epilepsy. So a ketogenic diet, high fat, low carbohydrates, which means the staples in this diet is going to be things like eggs, avocados, fatty meats, maybe offal, that is intestines and such like, which tend to be quite fatty, cheese, nuts, things like coconut chunks for those who have access to coconuts, and also leafy vegetables. So here the thing to note is that in this diet, you keep the carbohydrates at a very low level, because somehow some of the people with epilepsy have a high sensitivity to carbohydrates. So that is one thing that you can try, especially for younger children who maybe are finding the medication ineffective, or even for adults who maybe would like to see if they have an alternative to medication. Then, of course, we'll eliminate things like all sugar. This will have to be out, as well as refined carbohydrates, and to keep carbohydrates in general at a minimum, because there seems to be a link for some people with epilepsy with the high carbohydrate in their diet. Neolife supplements will also help. We recommend magnesium complex, vitamin B complex, as well as vitamin E. And as usual, you can choose between vitamin E and wheat germ oil, because wheat germ oil is quite rich in the vitamin E family. So those are the recommendations for seizures: magnesium complex, vitamin B complex, vitamin E, or wheat germ oil, not both, one or the other. And just also to recommend the ketogenic diet for something that you can try as a lifestyle adjustment. Maybe you can just try to progressively reduce the amount of carbohydrates in the diet until it is very low, and see how it is performing for the seizures. Maybe the seizure frequency reduces, or the severity, and so on. Then the next question, someone wanted to know what to recommend for a person who has got kidney disease and is on dialysis. So here, the lifestyle recommendation will be to follow the doctor's instructions, what the doctor who is taking care of the person on dialysis has recommended in terms of diets and other things. And then we also recommend that you opt for healthy food and plenty of healthy drinks, and keep junk food and such like things at a low level in order to reduce the toxin level. Because remember, dialysis means that the kidney is already really struggling and failing. So the less of toxins it has to deal with, the better. And the supplements we'll recommend will also be limited, because remember that the kidney and the liver are very important detoxifiers. We don't want to overload the person on dialysis with lots of supplements. So we'll recommend vitamin B complex, which tends to be deficient for them. We recommend beta-GAD to help with detoxing, and we also recommend vitamin A plus D, which is A plus D. And remember, as I said, in the lifestyle side, to follow the doctor's instructions, because they are the ones who will be judging how to go about the dialysis and to keep things in line and in check. Okay, the next question was about dementia. Just to say, there are several types of dementia. It's not all one thing, and they are different, and the causes related with them are also different. And we have got types of dementia that are related to brain injury. Maybe someone was in an accident or something, and they had some injury that is making them lose some of their mental abilities. Other types of dementia are related to drug abuse. For example, alcohol abuse and other types of drugs can bring about certain types of dementia. So lifestyle point here is, of course, to avoid anything that can injure your brain, whether it is drugs that you're taking, or if you're in high intensity sports, to consider having a helmet as far as possible to protect your head areas and your brain. We also recommend eating healthy food and minimizing processed metabolism. In fact, type 3 diabetes, because it's very closely linked to poor sugar metabolism. That means that foods that are high in sugar and refined carbohydrates for the person with dementia should be eliminated altogether, and they should try to make that we recommend. One of them is Mind Enhancement Formula, herbal preparation that contains brain supporting supplements in there. We also recommend vitamin B complex, recommend ProVitality. If a person is not able to buy the entire ProVitality, at least get omega-3 salmon oil. In the case where there is problems with sugar metabolism, it would be necessary to add botanical balance in order to help the body to regulate sugar better. And you can also add, if possible, coenzyme Q10. So those would be the recommendations for dementia. Remember also that dementia is a condition which, by the time you're noticing the symptoms, the illness has really already done some damage to the brain. So for these interventions, try as early as possible. And for all of us, of course, to be cautious about some of these problem foods that lead to poor sugar metabolism, because we don't want to endanger ourselves, because early onset dementia is becoming fairly common, just like early onset diabetes is becoming fairly common. This means that we need to look to what we put in our mouth to ensure that it is actually feeding our health and not fueling disease. Then another question was how to enhance fertility in a woman. So as a woman may be struggling with fertility or reduce fertility. Again, here we'll recommend in the lifestyle points, eliminate sugar and refined carbohydrates. Unfortunately, again, certain types of infertility are actually related to a diet that is high in sugar and other refined carbohydrates. So eliminate this, and also do a detox, especially if the woman has been using artificial contraceptives for a while, because for some people, artificial contraceptives actually can affect the level of fertility. So improve the diet by eliminating foods that are problematic. And then also you can do a Neolife detox, which in case it is residues that are in your system that are balancing the hormones, and recommend vitamin E as well as zinc. So herbal feminine complex for vitality, vitamin E and chelated zinc to support fertility in ladies who are having this issue. Then another question, someone wanted to know if full motion can be used in conjunction with calcium and vitamin D that has been prescribed by the doctor. As far as I know, there is no problem with this. Yes, you can use full motion because full motion is supportive of the healing process of the joints. I assume that the person is probably having a form of arthritis. And so full motion is going to support the calcium and vitamin D that you're taking. Of course, we would like that you use our CalMag and vitamin A plus D or vitamin D. But of course, if the person already has a prescription, maybe they fill that up and they can add full motion, which provides glucosamine. The glucosamine specifically supports the manufacturing, the body's production of cartilage, which normally in these joint problems, the cartilage has been worn out, but the body is actually able, with the right supplements, to rebuild the cartilage so that the joint heals. Then also full motion is going to contain enzymes that's that inhibit the enzymes that are responsible for speeding up the rate at which the cartilage is being destroyed. So remember, osteoarthritis, especially the cartilage is being destroyed, and there are enzymes that are involved in that destruction. So the nutrients in full motion is going to reduce the efficacy of such enzymes so that you slow down the destruction of the cartilage, while glucosamine is giving the body what it needs to rebuild the cartilage. Also, full motion contains other minerals that are supportive of joint tissue, which is things that it has a little bit of chelated zinc, it has boron, as well as silica. And so I think I highly recommend that in addition to the calcium and vitamin D, remember the reason we take vitamin D together with calcium is that vitamin D enhances the absorption of calcium. So full motion is going to be a good addition there. Then the next question, someone wanted to know what to recommend for fibroids. So again, this is another issue that is becoming common and could be linked to things in our lifestyle. It could be toxins that we are exposed to, either in the environment or in the foods that we take in. And so on the lifestyle side, once again, opt for healthy, minimally processed foods, eliminate sugar, and also do a detox. And then we recommend that you use cruciferous plus, very important, to help the body eliminate these unwanted growths, because fibroids are an example of unwanted growths, which those unwanted growths are often fueled by high sugar and high refined carbohydrates in the diet. So cruciferous plus, first supplement, recommended. Then herbal feminine complex to stabilize the reproductive hormones for the woman. We'll also recommend Betagard. If they are doing a detox, then of course they don't need to use Betagard. They can just do the detox and then go on with cruciferous plus, herbal feminine complex. And if the fibroids are also associated with heavy bleeding, we recommend that you add multimineral alfalfa just to replenish the minerals that are being lost as a result of the heavy bleeding. Then the next question was what to recommend for type 2 diabetes. Again, here, this is very much a lifestyle-related illness. So our recommendations on the lifestyle points will be minimize carbohydrates, especially refined carbohydrates. So minimize carbohydrates in general, but specifically refined carbohydrates even more so. and eliminate processed foods. Try to make sure that the carbohydrates you take are few and also that they are not processed. So it can be things like arrowroots, it can be things like cassava, yams, and so on, which are starches, but they are not processed, and they are fairly rich in fiber, which slows down the rate at which they interfere with our sugar metabolism. Then we also recommend avoid factory fats, which these are the fats and oils that are made in factories. So for example, out of maize or other such substances, which normally do not make fat. So these types of fats are made from raw materials that have no fat in them or have got minimal amounts of fat, which means they have got to be heavily processed in order to extract the fat from them. So avoid factory fats and rather opt for the healthier options, things like avocado, coconut, olive, and so on, because the factory fats do drive chronic and systemic inflammation in the body. Then we also recommend incorporating gentle exercise, especially walking after meals. It doesn't have to be crazy exercise like you eat and then you go out and start sprinting, but simply having your meal, which means you may want to have your last meal a bit early so that it's still possible to go for a walk. Or maybe if you're a member of a health club, you can go there and walk on the treadmill, but incorporate some kind of gentle exercise after meals, because this helps the cells to better metabolize the carbs. Then Neolife has got very excellent products to help resolve that type 2 diabetes. We have botanical balance. We have Tree and N. You can either choose between Tree and N or taking Provitality, which contains Tree and N within it. And then we also recommend fibers, which will work in conjunction with the diet that you have to help the body to manage the blood sugar levels better. So botanical balance, Tree and N or Provitality, and also fiber tablets. If you have multifiber blend in your market, you can also use that instead of the tablets. Then the next question was what to recommend for high blood pressure, hypertension. And the lifestyle points will be to incorporate exercise and movement in the lifestyle. And also this helps with heart health, because the heart is a muscle, and when we exercise, we strengthen. And we also recommend a healthy diet, eliminating processed food, factory fats, and the usual culprits that drive lifestyle-related illnesses. Neolife has got, again, excellent supplements for helping to resolve high blood pressure. This will be omega-3 salmon oil, or if you can manage it, Provitality. Then we recommend lipotropic adjunct and garlic allium complex. So 3 recommendations: omega-3 salmon oil, lipotropic adjunct, and garlic complex. If you are able, you can, instead of buying omega-3 by itself, you can use Provitality, which contains omega-3 salmon oil within it. Then someone wanted to know what to recommend for a hernia. So hernias are usually parts of the casing that supports our internal organs. Sometimes there can be a tear in it. And the first thing to do here is to discuss with the doctor whether or not surgery can be deferred, because a lot of times surgery may be required to close up the hernia. If there are certain hernias that don't require surgery, but some need surgery. So if you are able to avoid having surgery, then you can use Neolife supplements such as Neolife Shake. We also recommend chelated zinc, which helps very much with the healing of internal wounds. In fact, even if you do have the surgery, the supplement will also support healing from that surgery. And the third supplement will be vitamin C. So Neolife Shake, chelated zinc, and vitamin C. But remember, the first recommendation is to discuss with your doctor whether or not surgery is going to be necessary or can be avoided. Then another question is what to recommend for recurrent tonsillitis. This question comes up quite frequently. And the first thing to say is that the tonsils are actually part of our immune system. So they carry immune cells within them. And the fact that they are getting inflamed repeatedly may mean that our immune system is not working very well. So our aim here will be to interrupt this recurrent tonsillitis is to support the immune system. But for short-term relief, you can gargle salt water twice daily to help with a bit of temporary relief. And then with the supplements, we'll recommend vitamin C. You can also use, instead of vitamin C, if you prefer, you can use flavonoid complex. We also recommend garlic allium complex and herbal respiratory complex. The tonsils are quite related to the respiratory system. So those three, vitamin C or flavonoid complex, garlic allium complex, and herbal respiratory complex. Then someone wanted to know what to recommend for uterine hyperplasia. This is where the cells that are supposed to be in the uterus start proliferating, often in parts other than the uterus. So this may run in families and may also be autoimmune. So here we'll recommend on the lifestyle side, eliminate problem foods, because some of these problematic foods contribute to poor gut health, which is what is behind a lot of autoimmune illnesses. So eliminate sugar, processed foods, and opt for more healthy choices. Increase amount of movement and exercise, and then use cruciferous plus to help with, as I said before, cruciferous plus is quite useful in helping the body to deal with these unwanted growths or proliferation of cells where they should not be. So cruciferous plus, herbal feminine complex, and TRNN. Instead of cruciferous plus, if so cruciferous plus, herbal feminine complex, and TRNN. The cruciferous can be replaced by phytodefense. Then another question was about what to recommend for an infant who has developmental problems. So this could be that the infant is not able to do what they should be able to do at a specific age. And here in the lifestyle recommendation, my first recommendation, which I think I've repeated often, but will always repeat, is the extreme importance of breastfeeding in the health of infants and babies. If at all possible, babies should be breastfed for a minimum of 6 months, but preferably more than that, up to 2 years, because the breast milk is the perfect food for the infant and will also help to avoid the onset of problems and support the babies as they begin their life and their health span. So breastfeeding, very crucial. I know that it is not always possible. There are mothers who are not able to breastfeed. I'm simply recommending that where possible, if it can at all be managed, it's among the best interventions for infants. Then, of course, if the baby is having food other than breast milk, exclude all sugar and sweetened foods and processed foods. A lot of the tinned baby foods have got way too much sugar, so be careful as you look at the foods that are being packaged for infants, and try to make your choice as supportive of the infant's health as possible. Instead of some of these, I would recommend that for those cultures where fish is a staple food, to grind up fish and make a fish paste or fish soup for the little one. And you can also boil the fish to make broths and so on. And other cultural foods, rather than opting for tinned and processed foods, whose ingredients often we are not very much able to vouch for. Rather, prepare your baby's food yourself, because then you know what the ingredients are there. And if something is problematic, you'll be able to identify what is a problem. So those are the lifestyle points that I wanted to share. Then Neolife will support here, first of all, with Liquivite, because this is our infant supplement. We also recommend omega-3 minis, the little capsules. Of course, probably at this stage, the baby is not able to capsule, so you may need to prick the capsule and squeeze the contents into the baby's food. You can also give the baby Neolife shake. That makes the Neolife shake either with water or with something that is not sweet. Because when we introduce our infants to sugar very early, it becomes like a long problem trying to wean them off the urge to eat sugary things. So if you are making for them Neolife shake, maybe you might opt to use milk, which is not sweetened, or you may choose just use plain water. If you're making maybe a food paste for them, you can put the Neolife shake into the paste that you're feeding the baby. Then someone wanted to know, is 3NN safe for someone with type 2 diabetes? And the answer there is yes. Remember that our 3NN is made of the oils from the husks of grains and legumes, and so will not affect blood sugar. In fact, what 3NN will do is help the cells to recover their health and their sensitivity to insulin, so that the blood sugar level and the response to sugar will be better managed by the body. So the answer there is yes, 3NN is safe for people with type 2 diabetes. Then the next question, we lost a few minutes at the beginning, so I'm going to steal a few minutes from Pascal so that I get a few more questions in. So another question was about an infant whose bone marrow is not producing blood cells, so platelets and so on. So this can be as a result of a kind of anemia that affect the bone marrow, so that it is not able to make the components of blood which the bone marrow is supposed to make. This could be due to the infant having been exposed to toxin, or it could be an autoimmune reaction. So again, as before, for infants, I recommend try to breastfeed, if possible, for a minimum of 6 months, preferably for longer, 1 to 2 years. And then when you wean them into foods that are supportive of health. And meanwhile, supplement with Liquivite, our infant supplement, and Neolife shake can also be added there to help the body, the bone marrow, to manufacture these cells, and also to support the immune system in case the source of the problem is an autoimmune reaction. Remember that autoimmune reactions are quite difficult, but the way to start supporting them is to support gut health. So avoid introducing unknown ingredients into your baby's diet, because this could be what is leading to poor gut health, which could be driving autoimmune reactions. Then another question was, someone wanted to know whether chelated zinc and 3NN will help for fertility in a woman. And my answer there would be yes, I think they can help. However, I would recommend that you add herbal feminine complex to balance the hormones, and also, if possible, add vitamin E. So I think I had mentioned the question on fertility earlier on, but chelated zinc and 3NN can definitely be helpful, but a few additions maybe if they are able to do so. Then on the lifestyle side, minimize toxin load, because toxins can reduce fertility and cause things like fibroids and so on. Then also a healthy diet will be a good idea, and eliminating the usual problem foods. Then last question, I think, is still in the line there, of a person who is using an IUD, an intrauterine device, to avoid conceiving. And unfortunately, they are reacting to it. They are producing a smelly discharge, which is a serious symptom. It means that something is not right with this item that has been introduced into the uterus. So my first recommendation is discuss with your gynecologist or doctor, and have the IUD removed, and then be tested for an infection, because there could be an infection. And so I think here, my first recommendation is speak to your gynecologist or doctor, so that they are aware that this is going on and intervene immediately. Because remember that if this is not attended to, it can lead to fertility problems when a woman is now ready to have children. So, and of course, an infection in the uterus can be a very dangerous thing. So do see your doctor and discuss, as I've said. And then from Neolife, in the meanwhile, you can use BetaGuard for detox. You can use omega-3 salmon oil to resolve the inflammation that is coming from this item that is in the uterus. And then, of course, also, if there is heavy bleeding, I recommend you add multimineral alfalfa. So the questions still continue to be quite a number. So I want to leave you with those ones for now. I think we have made some headway, but also to encourage you to continue joining us on Thursday evenings, because we'll continue with the Q&As until we see that we have answered the majority of the questions. Of course, there may be some that we may not be able to answer. But remember, you can always send your questions directly to me if you want an answer urgently, if you see that we did not attend to it in the Q&A. So for now, I want to thank you very much and to wish you all the best as we are finishing this month of November. I know that it's a bit of a hectic time, but I hope that you are finding that your goals are within your reach, and you are working enthusiastically towards achieving them. So thank you. And here I want to pass you on to Pascal, who has